Hello, I'm Dr. Lauren Hyman, and welcome to Scooch Down, where you can talk to your gynecologist like you talk to your friends. Birth control pills are used by millions of women in the United States, and we've addressed risks and benefits of birth control pills in another segment. Today we're going to talk about cancer risks with birth control pills. Many women are afraid of birth control pills in terms of breast cancer because birth control pills are made of estrogen and progesterone, and there's a lot of information about estrogen and progesterone in terms of breast cancer risk. Birth control pills in multiple studies have never been found to be directly related to an increased risk of breast cancer. Certainly, if you have other hormonal issues and you have other risks that hormones can cause to become worse, for instance, a blood clotting disorder where birth control pills, the estrogen in them, can increase the risk of a blood clot, you should not be on them. But as far as a breast cancer risk, there is not enough evidence to suggest that a woman with a family history of breast cancer should not be on birth control pills because of the estrogen and progesterone. In fact, estrogen and progesterone containing birth control pills have been found to decrease the risk of ovarian cancer. And if a woman has been on birth control pills for 10 years, continuously or not continuously, the risk of ovarian cancer is decreased by up to 80%. Now, why is that? Well, estrogen and progesterone stop the woman from ovulating. So if the ovaries of the woman on the birth control pill are not ovulating, are not producing an egg each cycle, cells are not dividing. And dividing cells, cells that have divided abnormally, are what lead to cancer. One abnormally divided cell starts on the road to cancer. So if the ovaries are not dividing, the ovaries are not as at risk for having cancer in the future. Birth control pills also decrease the risk of uterine cancer. How? Well, the lining of the uterus is either growing and shedding consistently each month or has been thinned by such an extent because of the birth control pills that the lining of the uterus is at a decreased risk for developing one of those abnormal cells. So when we're concerned about cancer risk with birth control pills, let's remember there is no definitive evidence that birth control pills increase the risk of breast cancer, and there is definitive evidence that birth control pills decrease the risk of both ovarian cancer and uterine cancer. This has been Dr. Lauren Hyman. Thanks for tuning in to Scooch Down. We'll see you next time.